How do you deal with claustrophobic patients, ones who cannot tolerate the confined space of the MRI scanner?
So in another video, I talked about how MRI scanning is entirely innocuous. There's no radiation, there's nothing injected, it's completely painless. All of this is true. But I did describe that the day of the MRI scan, of the DTI scan, which is done in an MRI scanner, at any one of our 32 imaging affiliates at last count in the country, there's no special preparation that's needed, and you're not gonna feel any pain, you're not gonna get an injection. There is one yellow flag for some patients. When you go into the MRI tube for this DTI scan, it's narrow. And some patients have varying degrees of claustrophobia, just fear of being in enclosed spaces. This is not that common, but it does happen. So MRI imaging facilities and DTI imaging facilities, which use MRI, they're used to this. And so in many patients that have claustrophobia, that's basically won't allow them to do the MRI scan, the DTI scan, they can offer some IV sedation. So our imaging affiliates handle that directly. So if we're gonna refer you to one, please speak to them about it directly. Overwhelmingly, they're able to handle that request, and you'll get some IV sedation and you'll be relaxed, and it should help you manage your claustrophobia better inside the MRI scanner. One important note, if you're gonna do that, you cannot drive yourself home. So please have a friend, family, or loved one drive you to your imaging appointment for your DTI scan, because you're still gonna be a little groggy and it wouldn't be safe to drive home after that. So claustrophobia, very, not overall very common, relatively uncommon, but common in the context of DTI scanning using narrow MRI scanners. If you have it, don't worry about it. Our imaging affiliates deal with this all the time. And in most cases, they can offer a little bit of IV sedation to take the edge off and to make you more comfortable during that MRI scan.